Now that your doctor has informed you that your PSA blood test is high, what should you do? Because you may have prostate cancer. I'm going to talk to you about something that you should know. Prostate Specific Antigen. What is it? The PSA blood test, also known as the screening test for prostate cancer, has proven to be a useful tool. However, there are some drawbacks and implications to the test that I can walk you through. Generally speaking, the PSA blood test normal range is 0 to 4. But many men have readings that are high as 5, 6, or 7. Typical reasons for high PSA. Actually, there are several explanations for why a PSA blood test result could be abnormal. The most frequent cause is an infection. Prostate cancer screening using PSA tests is not always the best option. Because of conditions such as prostatitis, enlarged prostates, infections of the prostate, bladder, kidneys, and occasionally infections elsewhere in the body that can momentarily raise the PSA outside of the normal range. Second, the PSA blood test may still be unusually elevated due to persistent inflammation or past infections that have healed. A more frequent cause of an increased PSA blood test is an age-related alterations in the prostate, known as benign prostatic growth or benign prostatic hypertrophy. Prostate enlargement and elevated PSA are frequent causes of BPH, which are not indicative of prostate cancer. Naturally, an elevated PSA blood test might indicate abnormalities related to early or advanced prostate cancer. Men who have innocuous reasons for their PSA to rise should not receive excessive diagnosis or treatment. Here's the second thing to know about the PSA blood test and prostate cancer. Even if you believe an increased result might indicate prostate cancer, you should not panic. Prostate specific antigen and further health issues. We will discuss prostate cancer in relation to other health issues. Patients are examined by cardiologists with a high PSA or general practitioners. They should have a prostate biopsy performed since the danger of a heart attack must be considered when evaluating the PSA. And cancer risk. Stroke, diabetes mellitus, obesity, dementia with Alzheimer's, fatty liver arthritis, as well as any other chronic ailment that usually results in death or severe pain in people. Therefore, all the adverse effects of surgery and radiation for prostate cancer may be avoided. These treatments will still affect erections, urine function, and men need for diapers, though they may also be cured, so don't discount the possibility of a cure. However, the adverse effects of the therapies are permanent. Now, if you are 75-year-old with an elevated PSA and heart disease, having had a bypass surgery, and having diabetes, you should consider that your risk of cardiovascular disease is likely greater than your chance of prostate cancer. The testosterone that measures the amount of your male hormones. A PSA cannot be adequately understood without a testosterone level. Although eliminating testosterone from patients with advanced metastatic prostate cancer won a Nobel Prize 70 years ago, It may not be entirely correct to say that testosterone is harmful. This is an illustration of claiming that while testosterone may feed cancer, it is not the cause. It would be analogous to blaming gasoline for a fire when the matchstick is the real culprit. Now, testosterone is important because it can always be lowered to lower the risk of cancer. If your PSA is rising or your prostate is growing, we can always lower your testosterone levels. More concerning is the situation where there is low testosterone and a stable or rising PSA, as this raises the possibility of hormone-resistant prostate cancer. We are concerned about prostate cancer and prostate specific antigens that are increasing in spite of low testosterone levels. Therefore, it is important to know the level of testosterone in order to determine whether the PSA is growing in an environment rich in testosterone or whether it is growing in an environment that is low in testosterone and very aggressive. To be more precise, people with diabetes and heart disease have reduced blood flow to their testicles, kidneys, and heart, which may result in low testosterone levels. As a result, these men are more likely to have aggressive forms of prostate cancer if and when they are diagnosed with the disease. Therefore, it is critical to consider prostate specific antigens levels in relation to testosterone. Additionally, before we run out of time, let's not forget that the modern world includes an MRI machine, which is becoming a very useful tool for determining the shape, structure, and presence of early prostate cancers in the prostate. It performs much better than the outdated finger exam in the rear and is superior than depending only on a PSA. If you have an abnormal PSA, a family history of prostate cancer, and access to an MRI, it can be a very useful tool in determining your individual risk of prostate cancer. Create a personalized treatment plan and conduct personalized screening, not only for cancer risk and treatment, but also for comprehensive health. Lowering the risk of diabetes, obesity, and heart disease, because all of those cardiometabolic diseases are closely linked to the risk of prostate cancer and vice versa. Thank you for watching today's video, and if you have any questions or comments, don't forget to leave it in the box below. Till next time, bye-bye.